wants to help and whatever it takes to help those people. So please give a warm welcome to Dr. Herb Akers.
Thank you, Justin. Well, hello again. It's my pleasure to be here to say a few words on health. This evening we're going to be talking about health and hormones. I call it a brief concepts guide. The reason I say it that way, it's so easy to be caught up in the details and about the biochemistry. So hopefully during this lecture we'll sort of have a better understanding and a simpler practical guide of what's going on about when you hear the word hormones and health. So the first thing I think about when I hear somebody is recommended to take some hormone therapy, I'm thinking that the vast population will be saying something like, well, somebody's mother has to go on estrogens and things like that. So it seems like it's a middle age or later years idea of something's wrong with their hormones. Now, part of that is true, but it speaks about so much more than just the health of the hormones. As we get into this, we'll see it reflects so much more. And the first thing I thought about is what the heck is a hormone, because it's not easily understood. So I just got a very simple definition. This is one just right off the internet. You know, many of various substances produced by body cells and released especially into the blood and having specific effects on cells or organs of part of the body, usually at a distance from the place of origin. So this will become clear and we'll get into some more details. So the first question I had is, like, you know, remind me what hormones are. That's a concept by the internet. Now let's move deeper, because after you say, well, my body is signaling things to happen incorrectly because we're still standing here and have reasonable health, my hormones must be okay. But why should I care about hormones unless I'm maybe old? So again, that's sort of like if we're middle-aged getting to the menopause, we're saying, well, I need hormones, but if you're 20 years old, why would you need them? So I'm going to say the hormones are constantly interplaying with your health at all ages, even when you're young. There's hormonal balancing and going out through all the ages, not just when you're middle-aged or need to have some intervention because of some kind of health issue. And so in a way, when a time that a doctor may suggest to an older lady, or that middle-aged lady, well, you know, you need to have some hormone tests. What's happened is that this lady probably has had some struggles through life or health challenges that were really under the radar, I say. So it'll show up with hormone imbalances, but is that what it's talking about? Or maybe is it talking about something deeper? Is it talking about your entire life? And tonight we're going to look at, well, what does make these things shift and change, and why is it important? Our hormone balance reflects how well our body has dealt with life's stresses over a long period, and how well our body's systems have maintained itself. Now, when you look at it from that perspective, it says, wow, this is sort of a stress marker. This is a telltale sign of how our body has dealt with ourselves, our life, and our health over a long period of time. Not, hey, I'm in menopause, my numbers are going to go crazy, I need to take a hormone supplement, right? So it's not quite the same. The reason why you want to know about this at all ages is because it does almost everything. So everything from sort of the most important part, I mean, they're very important, but look at this. This is DNA, RNA writing, which means this is how your body builds each cell. So within each cell you have the genetic material to build things, but unless you have the correct hormone levels, your cells aren't even going to be there. You're going to construct something quite different, right? So it's really, at a fundamental level, this is how your body builds. Metabolism, which we're all sort of interested in, the mitochondria needs to have that hormone balance in order for it to function. This is huge, because without the mitochondria, you know, you wouldn't be here. And this is how we power everything up. And then, of course, stress response. I mean, your survival skills are in case animal attacks, things like this. This is how we defend ourselves. So stress response and hormones are integral. Blood sugar, another important part of healthcare, that's also linked exactly to our hormone response, our hormone levels, and who isn't interested in blood sugars today? Reproduction, obviously, this is how we procreate. This is without the correct hormone levels, it's just not going to happen. And of course, immune support and longevity, brain function, thinking clearly through life. So we can easily see the nuts and bolts of hormones are critical and important. So that's why everyone should consider that, not just, oh, I'm at that age where we need to look at our hormone levels. Maybe that's changed. Well, maybe it's been changing the whole time, and it usually has. Okay, so I'm going to throw some neuroendocrinology at you just to be fancy here. I'm not sure I can even spell it. But what we're going to be talking mostly today is this guy here. This is the hypothalamus pituitary adrenal axis, the HPAA. Now, this guy is what the science looks like they look at this body and they see how well has this person dealt with stress over time, and that's the axis we're looking at. This is these three major glands in the body that are communicating all the time. Now here's a lot of stuff that you can, if I had a hand I'd give it to you, but this is sort of like the big things that they do. In a nutshell, it does exactly this. The hypothalamus is processing all the thoughts you're having. Your reality in life is going into that hypothalamus. Your hypothalamus is making a life and death decision about something is going to happen to me, I'm going to react. It pushes down into and signals the pituitary, which begins the releasing hormones here, releasing molecules here to the adrenal glands, so you can actually do something simple like, I'm going to run, I'm going to fight, I'm going to defend, I'm going to do something because I've been stressed. Now, at this HPAA axis is really behind all the hormone tests that you're going to be doing, because this is stress response. This is the science of stress response. It's this axis of brain to your body, the neuroendocrinology part, right? Very, very important. You don't have to, there's no quiz on this, you won't have to memorize, but I'm just giving you some basic background. And now we go into some of the details about the terms you're probably familiar with. For example, survival is number one in this body, and the survival hormones are from the adrenal gland, and we're probably very familiar with cortisols. Now, in a way, I broke them down into this good cortisol and bad cortisol, right? And so the good cortisol does all these kinds of things. Shock absorber hormone, that's what they call it. It's amazing because whatever you're happening to do, it's able to take in the shock and buffer it and survive all kinds of stresses that your life's going to throw at you, right? It'll keep all the glucose available for energy. It's sort of like cortisol is your action hormone, right? It's going to be, hey, if I have to fight, it's going to lift your cortisol so you can build and create and fight if you need to. And at the same time, as you can imagine, it lifts glucose. So since your muscles need sugar to operate, it's going to fill a lot of glucose response. It's going to lift your blood sugar high enough so you can defend yourself. Now, what happens when we get a bad cortisol? Well, this is quite simply when you have excessive stress or stress that continues all the time. You have a condition where you have prolonged cortisol or elevated cortisol or even diminished cortisol, because there's like, this person's undergoing too much stimulation from stress. And the problem with that, of course, we have these types of things, the chronic illnesses, obesity, heart disease, diabetes, immune failure, depression, sexual dysfunction, Alzheimer's. Everything that we don't want is connected to how our body's going to respond to stress. Oh my gosh, I don't want more of this. Even though it's coming at us all the time, we want to try to avoid that. Now, coming down to the adrenaline, most folks we know what adrenaline is. It's our fight or flight. It's our immediate quick response. Of course, the good part about it is we're able to respond quick enough for a challenge. The bad adrenaline, like I say, is like if it's happening all the time, it also makes your body, like the heart for example, always be on alert, always fighting too much. So it gets chronically stuck in that overstimulation, similar to the cortisol, but this is the quick responding. into straight sex hormones, we all need these. This is what we do healthy. We need to have the estrogen for the regulation of production and reproduction, secondary sex characteristics, of course. Even at bad levels, when this gets out of balance, we have it connected to different tumor generation, right? So this is something that we want to avoid. We want to make sure the estrogens don't go in the wrong place, because it's growing things. Estrogen has a lot of growth effect to it. Testosterone, of course, we need this for life. All the aggression, all the muscle, all reproduction, you need certain amounts. I mean, who doesn't have some commercial where there's low T and every male has to have them? The problem with this, I find that if you just say everyone who's going to be a male needs more testosterone, I want to look behind that. Well, why does this person's testosterone get low in the first place? And the answer is always going to be this person must have picked up some sustained chronic stresses that's sort of burning him out. Because in a normal situation, it's not like everyone needs to have low T. Something's occurring in his world. And it's very individual in a way. Even though in a modern society we tend to have more stress and we tend to have more low T issues. Good progesterone, again, this is fertilization. It talks about, and these are the types of things that the labs will look at that we're going to go over in a bit. The good progesterone, the bad progesterone. And again, these are the types of things that will show up when somebody who is in, like a woman who goes through perimenopausal, that they'll take a look at those levels and then we'll say, well, this is where you're at. Every woman's going to be that way, and you need to have some kind of therapies to improve them. And I sort of agree, but I sort of see we're not looking at the bigger picture as well. Now, the DHEA, again, this is a very important DHEA in healthcare. We like to use this because this is sort of like that forgiveness hormone. It balances cortisol, and cortisol, when it's in excess, of course, is going to be too stressful, and the balancing hormone is more DHEA, or trying to get the body to create more DHEA. The easy example I give my patients as far as DHEA and cortisol, if cortisol is like you're under a stress and the IRS is giving you a tax audit, the DHEA is like you didn't get audited and you got a free trip to Hawaii. Because as soon as you have that feeling through your body is pushing more DHEA. The comfort, it's like it's solved, I've healed, I'm fine, I'm happy. So this is the happy one you want. The only bad DHEA actually is when it's too low, because it's been pushed down too much from the cortisol. So those guys are in balance. They push up each other. So we obviously want more of these guys in here. The pregnenolone is famous for its brain function and improving mentation. It's another positive one which we need to have in good amounts. Okay, so after filling you with some background about what hormones are doing, so I say, so what's the problem, right? Well, here's the problem. Our hormone levels, again, are reflected by a lifetime of a terrain of stresses and things that happened. And it is easily modified by something as simple as, well, it's really connected to age. A lot of folks will write about that. I sort of agree. But absolute nutritional stresses, movement stresses, toxic stresses, physical and mental stresses, and just being human will accelerate and basically mess up our hormones, right? So after saying the first couple of slides of saying hormones are so important, I'm glad we have them, I say they're too vulnerable, right? So something is important of having good hormone levels. They're just too vulnerable for everyday life. In fact, here's a thing that in my practice, I focus on, and it's this. Sabre Labs that we use here is a fantastic lab, and what they do is when they're looking at hormone balances, their focus is on what the adrenals are doing. And the reason they do that, because they know in healthcare, in the body, our body's priority is to survive. And so what they want to do is they want to take a look at all the hormones that they test for, but they want to especially look at what the cortisol and the DHEA is doing. Now, why? Because since we're so survival based, you have things like this. We have our bodies really reacting instinctively. to things like life and death. It's like everything can be life and death. Our body feels it, and it doesn't actually turn off. So if we come from perhaps a time where stresses were sort of simpler, and let's say an attack or some stress that happened momentarily, as soon as the attack or the stress is over, we can celebrate and get good rest and have something to drink. However, this old simple stress doesn't actually play out anymore, because I can go all the way into today, because there's an unending, I'm not against the internet, but I'm telling you there's so much information that you can stress about 24/7, where your brain will actually react and tell your body to react to it as if it's just real and right in front of you, right? Wow. Now, just being human, basically, you know, it's sort of like, this is my little slide of the guy who looks like a businessman, but he's wearing a caveman suit, implying that underneath our sophistication, you know, our body is still reacting from, you know, we're having adrenal responses from things like bills that need to be paid, you know, potential wars that are on the horizon, how a government is being run. So those types of things are supposed to be short-lived in the old way of our body's thinking, but in today's world the uncertainty goes on continually. So there's a real understanding about, wait a minute, where are our hormonal balances coming from? Perhaps it's our lifestyle with this modern world getting continual news cycles of things to stress over. Yes, like today we experience the stress of uncertainty, but our body reacts as if it is a life and death moment. So our modern mind is hoping it's happening like that. But what our body is usually thinking is something like that. It's like, oh, this person cut me off on the street, you know, he's a terrible driver. But it's not life, you're okay, but it won't relax. It holds on. We tend to be again, our body is the one that likes to have a momentary, quick, acute response, and then let it go. But we don't do that. So to summarize that, our nervous system has evolved to deal with an immediate stress. Our body reflexly reacts with drama. Our hormone system reacts with insistence on immediate resolution of stress, which is rarely possible. That's our hormone system, and it's very old, and it's kind of stuck in its ways. Our modern world is made of mostly abstract stresses. You know, who will be the next president? That was an old slide. It happened. Our body has difficulty handling long-term problems. Our body puts its long-term responsibility projects on hold in order to survive immediate threat. What that means is, like Carrie Nozzle was mentioning the other day about prioritizing, our health and our body prioritizes everything. So if it has a priority to defend against threat because I'm in danger, I don't feel comfortable, how about the house cleaning, which is more like the detoxification? Well, let's put on hold. And that's why we have slow, sluggish filtration systems while we're under stress, right? So again, while we're under stress, we're trying to say, hey, if I have enough glucose, I can defend myself, I can run, I can fight, I'll overcome this enemy. I don't need to clean anything, I don't need to filter, I don't need to worry about my cholesterol levels or filtration of toxins that are coming in from my environment. So again, it's a distraction. It's like your body's prioritized towards stress response and is not cleaning up, which happens far too much. Consequently, and the hormonal balance are created by the chronic stresses. The liver is the major organ sluggish, then you build up, and then you have elevated cholesterols too, and estrogen. So you have a lot of these substances, the hormones that are manufactured in the liver. If the liver isn't doing its pace of creating and breaking down and filtering and getting them, passing them out, then it builds up, right? Well, why is it not paying attention to filtering? Well, it's prioritized against for survival. Right? So the idea is that we're distracted a little bit, trying to take care of first things first. To make matters worse, I'm going to throw this one in that's not as a common understanding. This is another thing that happens. Since our body is very survival based, if you get into, let's say, the physical stresses, if you play sports and roll your ankle for something as simple like that, or any kind of slip or fall or back injuries, well, the body typically won't forget that either. It's going to put that on its list of things to worry about. And what it does is it makes compensations. So if your body is not going to comfortably stand on one leg because of various injuries from sports, it's going to push and compensate to the other side. And when it does that, it's going to have more and more stress just walking and balancing and moving. The problem with that, walking and balancing and moving, has a higher priority over the liver. It has a higher priority over everything, actually. It's amazing. So if we don't pay attention, stresses that will build up in all kinds of directions, stresses from our appetite and what we're eating, to the toxins in the environment, all those things will create congestion and slow processing of the food, which brings up, oh my gosh, yes, I need to do a detox on a regular basis. Yeah, you have to. It just, every breath you take, I'll be watching you. Yeah, but it's kind of crazy because I work with so many athletes, and they don't, once you get a good hit, you don't play the same. And you can just feel, I don't feel comfortable moving that way. It's as if your body knows, no, no, you can't do that. I remember what happened last time. And that's just not right, because you have to get your body out of your stress picture in order for you to have normal hormones and good vitality. It's like, man, my body's worrying about that injury I had 10 years ago. It's crazy, right? And these happen. Okay, now let me talk a little bit about the ENA sciences and the labs that we do here. It's parent labs done by Sabre, and what they do is, like I said in the beginning, they prioritize the adrenal glands. Why? Because they know about life stresses affect the adrenals first, because life is going to be survival based first. It's going to really threaten your survival. So that's why they do these labs, really looking at all the factors, but not as high as they are. It's more in relationship with the rest of them, right? So they're going to measure, they're going to do saliva tests to give you a real life, what do your levels look like, what's the cortisol, DHEA, what are the levels are they doing actively with your age, and they will create and match it with patterns. Now, the idea is that they're going to identify the overall dysfunctional pattern that you have, and then they're going to match it with the other disease pathology patterns that they've collected over the years. So they're able to not only say, hey, your testosterone's too low, let's put more in there. They're going to say, your testosterone is low here, and because of where the estrogen is and where the DHE is, this is where you are in stress level. We know this pattern. And then they start to build you from the base of trying to build up all of them together, because they're familiar with the patterning going on. And that's sort of what healthcare is about. They all work together. All the factors in your blood and your whole body is really in a concert. So it isn't individual. And you can't do it individual because it just doesn't work. Okay. So, all right, so it sounds, what do we do from here, right? Yes, your hormones are vulnerable to stress, but what do we do to optimize them? So I'll put just some basic plans here. I say the first thing you do is the assessment, to take a look at the pattern you have in your hormones at any age. And what that'll do is it'll sort of give you a stress assessment. Where your body is, why is it vulnerable to this? At your age, you should be over here, but because this is happening, you're going to be likely to have this going on, or another dysfunction going on that's going to show up in your future. So they're not looking just at one marker. They're looking at the pattern you're having, and they're saying, well, that pattern is going to connect to this disease process over here or over here. This is where it looks like your stress life has led you and where you're going. And then what they do is they formulate a correction to that. So they're gradually pulling you back to a norm healthy, given what your lifestyle that has shown on the saliva reports. Now, the rest of it, of course, is so important. The detoxification with the endocrine, the reason we've gone over why we have to detox is because during stress, your detoxification process is not emphasized any longer. It's down-regulated. It says, hey, who needs to detox? I'm fighting. Right? And so that's why I put that in. I take it daily, of course. Now here's another thing too. When we're looking at a lot of stresses, we want to support the adrenal because there are lots of herbs that are very adrenal supportive. Then of course the Delta E with brain function and clarity. I believe I'm on it right now. The meditation, of course, is it's part of life we have to do. We have to find our own type of meditation, to find that calm spot, to sort of be the eye of the storm. Trying to be in the storm, be the quiet place where you're surrounded by the craziness around you. It's sort of like how we do it. And you can't check out. You just sort of have to deal with what you're dealing with and be as calm as possible. This is a little plug for the work that I do, because what I do is I take some of that stress out of that body memory, and the body memory is in the soft tissue. I'll tell you a quick note about what we understand about how the body operates is this. Like I mentioned before, if we sprain our ankle, what will happen is not only do you have the injury to the ankle and to the ligaments and the tendons and the muscles and the nerves, but when it heals and it looks right and I can weight bear on it, the problem is your body has still a memory of that ankle. And what that means is that it does not have a picture of that ankle in the brain. Your nervous system can't see it any longer. So that's that proprioception word I may have mentioned here earlier. So your body is blind now to injury sites. So that's why does a person sort of limp? The body limps because it doesn't recognize, can't see that foot, can't see that hip. So it avoids it because it doesn't trust it. So your nervous system will not power up a part that it can't see. So that lack of proprioception is the key. So the work that I do is I do this fascial release that will allow your body to sort of reinitialize, find the proprioception, find that joint that's been damaged, and it will find it automatically by this type of approach, and then we'll start to fire it up and start to connect with it and start engaging with the rest of your body. Because the body doesn't want to be damaged, it just hasn't, no one's told the body that, hey, it's still there, because it feels like to the body, to the brain, it feels like I've lost my leg, my right foot, can't see it, can't feel it, I don't want to use it. So it avoids it and limps. The problem with that is that you end up with back problems. So anyway, that's a little plug for myself. And I believe that is the end of my lecture. And I'll answer any questions whoever has one.
You just hit right on the last, about December, I fell from 4 stairs.
Yes.
Holding my grandbaby in Washington. And everything happened in slow motion, and I remember going down. What happened is I'm wearing socks and I step at the edge of the step and I'm rolling, and I fell to the point where to this day, I am at church, and when I'm going to get up from kneeling, my body feels that stress on my right here. And because the way I landed, as I twist like this, I feel it here to there. This is since December. And my body will not, and I walk sometimes, I work downstairs on my total gym. And when I work out and the blood goes in there, it feels okay. But by the end of the day, or when I'm already relaxed,
it's still back.
It is.
It comes back.
And I feel it right there. So I'm dealing with that, so I need an appointment with you.
Okay. Well,
I don't want to be crippled. You know, I have active grandkids.
No, that's a very good point, because even like an injury like that raises your cortisol, because your body is stressing. It's trying to, the inefficiency of your movement is elevating your hormones. So that in itself can be a stressor, and it does. So yeah, I'll take a look at that. Maybe we can work on that tonight.
Yeah, I really feel uncomfortable. It really does. And I massage it. I do. No, it's not there.
Okay,
so
very good. Thank you. We'll take a look at you.
Any other questions?
Let's say do this test and you're low or high in certain hormones.
Yes.
What's the fix there? In other words,
yeah, so what it does is when you do the hormones, the natural creams, what they do is it'll start to bring your body, it'll make your body give the information to your body as if, hey, everything is actually, instead of going toward the cliff and going over, it'll make your body feel like, hey, I'm going back into that youthful place. It'll center you. Because it's doing it, like I said in the beginning, it's going to do it at all the systems in your body. You know, all the cells that are expecting a certain hormone, it's pushing toward bringing those back. So it's working at a very deeper level. Not just, hey, here's a pill to make it feel better. It's giving the sense of the cell that I'm more youthful. Of course, I don't have that history. It's going to bring you back to a youthful place. So I highly recommend it. Yes, Dwayne.
So you do the saliva test.
Yes.
Then they will do the analysis and they'll suggest, or they'll send you creams.
Yes.
Okay. Can you just encapsulate that process? So it's ENA Sciences, which is doing their lab work with what company?
Sabre.
Sabre.
Yes, and they've been correct for like 30, 40 years. I mean, it's run by Dr. Borkin, a well-known, well-respected, highly accredited doctor who's advanced the way natural hormone and delivery systems are being done. So he's way ahead of the time, and we're very happy that he's able to give us some of these products that I can use on my patients to sort of restore their health. Right, so yeah, so the creams come in and sort of the balancing creams, they're done in a mixture that will start to balance your background, balance your hormone levels in the background. And we can talk later about it. Okay.
One small question. How
Yes.
much does family history play into these sort of diagnoses?
You know, the family history, now you're bringing up the topic like epigenetics. Okay, epigenetics is really not using familial hereditary traits and genes, more about what does your environment have to influence you. And so as someone who does alternative health, I know the epigenetics is what we really want to key on. That just means how much is your gene being triggered by your environment today, on your lifestyle, what you eat, what you do, what you think, what you feel. So we play that more than saying, hey, I'm going to get this disease because my grandfather had it. Right, so we're leaning toward making some changes with some natural remedies. So through energy balancing, through body work, through nutritional supplementation, a lot of cleanses, and it's a very smart way to go. It's the future of healthcare, energy medicine.
Any other questions?
Did you talk about, before I just stepped in, on the creams being nutrient-based?
Yes, they are absolutely nutrient-based, yes.
Which I think is really big.
It's huge.
Instead of giving the hormone,
Yes.
they're giving the nutrients that
Yes. Right, and it's like I was talking to an earlier patient about like thyroid and being on thyroid hormone, but giving someone thyroid hormone doesn't necessarily balance your thyroid. So you've got to actually find out where is this body deficient and what does it need. And certainly the thyroid is involved with so many different, through nutrients, minerals, in order to make that shift and change, because you just can't give them one piece and expect your body to go, well, this level went up, aren't you feeling better?
Yeah, so it's not, I know this, but I'm just
Yes.
validating.
Yes,
it's
absolutely.
not hormonal replacement.
No.
It's actually nutrition
Yes.
to get the hormones.
Correct. You want your body to do it naturally by itself.
Good.
Yes.
Any people that you can share about, like testimonies or people that you've seen a very big change when you started using the creams at all?
Yes, some of the, like a woman I know, it just took, sometimes it'll take a while, another cycle, another cream before, yes, she started out okay, but the thing that may hold the person back with the creams is that you have to look at two things, adrenal function and liver function. In other words, if the person has a lot of adrenal deficiencies, it may take a little bit longer for the creams to be effective. And if they have a lot of toxicity, you've got to go some liver detoxification first as well. But when it works, they'll feel it, and they'll feel naturally balanced and functional again. And so the benefit of that is you're addressing the typical things. The adrenals being addressed, your liver functions being addressed, and you're getting all that hormone balancing in the background. So it's quite nice. It's a smart way to balance hormones.
Any other questions?
So your detoxing would be considered the enterprise?
Yes, yes, but I also, in fact, I've used some other Saver products to be a little more aggressive for the liver too, because they have a transdermal for detoxification as well.
Okay.
That you apply right to the liver. It's kind of cool. Yeah.
And then water.
Yes, of course, yeah.
Water's a key factor.
Yeah.
Okay.
All right, very good. Hey, thank you very much for listening, and I hope you sort of take it to heart and just understand hormones are not for old people. It's for human beings, right? At all age.
And
Very
it's
good.
not just for women. When you hear the word,
Oh my gosh, no.
men think that, oh,
I know.
with women issues.
True,
Right?
true. Unfortunately, true.
This is for men too.
It is for men too.
And I'll actually add on that part.
Good.
Thank you.